Vitamin B2 Riboflavin. Vitamin B2, also called riboflavin, is one of 8 B vitamins. All B vitamins help the body to convert food carbohydrates into fuel glucose, which is used to produce energy. These B vitamins, often referred to as B-complex vitamins, also help the body metabolize fats and protein. B-complex vitamins are necessary for a healthy liver, skin, hair, and eyes. They also help the nervous system function properly. All B vitamins are water-soluble, meaning the body does not store them. In addition to producing energy for the body, riboflavin works as an antioxidant, fighting damaging particles in the body known as free radicals. Free radicals can damage cells and DNA, and may contribute to the aging process, as well as the development of a number of health conditions, such as heart disease and cancer. Antioxidants, such as riboflavin, can fight free radicals and may reduce or help prevent some of the damage they cause. Riboflavin is also needed to help the body change vitamin B6 and folate into forms it can use. It is also important for growth and red blood cell production. Most healthy people who eat a well-balanced diet get enough riboflavin. However, elderly people and alcoholics may be at risk for riboflavin deficiency because of poor diet. Symptoms of riboflavin deficiency include fatigue, slowed growth, digestive problems, cracks and sores around the corners of the mouth, swollen magenta-colored tongue, eye fatigue, swelling and soreness of the throat, sensitivity to light. Cataracts. Riboflavin is also needed to help the body change vitamin B6 and folate into forms it can use. It is also important for growth and red blood cell production. Most healthy people who eat a well-balanced diet get enough riboflavin. However, elderly people and alcoholics may be at risk for riboflavin deficiency because of poor diet. Symptoms of riboflavin deficiency include fatigue, slowed growth, digestive problems, cracks and sores around the corners of the mouth, swollen magenta-colored tongue, eye fatigue, swelling and soreness of the throat, sensitivity to light. Cataracts. Vitamin B2, along with other nutrients, is important for normal vision. Early studies suggest that riboflavin might help prevent cataracts, damage to the lens of the eye, which can lead to cloudy vision. In one double-blind, placebo-controlled study, people who took a niacin and riboflavin supplement had fewer cataracts than people who took other vitamins and nutrients. However, researchers do not know whether that was due to riboflavin, niacin, or the combination of the two. More research is needed to see if riboflavin can really help prevent cataracts. Autism. Preliminary research suggests that supplementation with vitamin B2, along with vitamin B6 and magnesium, reduces the level of dicarboxylic acids, abnormal organic acids, in the urine of autistic children. Dietary sources. The best sources of riboflavin include brewer's yeast, almonds, organ meats, whole grains, wheat germ, wild rice, mushrooms, soybeans, milk, yogurt, eggs, broccoli, Brussels sprouts, spinach, flours and cereals are often fortified with riboflavin. Riboflavin is destroyed by light, so food should be stored away from light to protect its riboflavin content. While riboflavin is not destroyed by heat, it can be lost in water when foods are boiled or soaked. Roasting and steaming foods preserves more riboflavin than frying or scalding your foods. Available forms. Riboflavin is generally included in multivitamins and B-complex vitamins. It also comes separately in 25 mg, 50 mg, and 100 mg tablets. How to take it. As with all medicines, check with a healthcare provider before giving riboflavin supplements to a child. Daily recommendations for dietary riboflavin are as follows: pediatric infants, birth to 6 months, 0.3 milligrams adequate intake. Infants 7 to 12 months, 0.4 milligrams adequate intake. Children 1 to 3 years, 0.5 milligrams RDA. Children 4 to 8 years, 0.6 milligrams RDA. Children 9 to 13 years, 0.9 milligrams RDA. Boys 14 to 18 years, 1.3 milligrams RDA. Girls 14 to 18 years, 1 milligram RDA. Adult men 19 years and older, 1.3 milligrams RDA. Women 19 years and older, 1.1 milligrams RDA. Pregnant women 1.4 milligrams RDA. Breastfeeding women 1.6 milligrams RDA. Riboflavin is best absorbed when taken between meals. People who do not eat a balanced diet every day may benefit from taking a multivitamin and mineral complex. Precautions. Possible interactions. If you are currently being treated with any of the following medications, you should not use vitamin B2 supplements without talking to your healthcare provider first. Anticholinergic medications. Doctors use anticholinergic drugs to treat a variety of conditions, including gastrointestinal spasms, asthma, depression, and motion sickness. These drugs may make it hard for the body to absorb riboflavin. Tetracycline. Riboflavin interferes with the absorption and effectiveness of the antibiotic. Tetracycline. All vitamin B complex supplements act in this way. You should take riboflavin at a different time during the day than when you take tetracycline. Tricyclic antidepressants. Tricyclic antidepressants may reduce levels of riboflavin in the body. These include imipramine, tofranil, disimpramine, norpramine, amitriptyline, halovial, nortriptyline, pamela. Antipsychotic medications. Antipsychotic medications, called phenothiazines, such as chlorpromazine or thorazine, may lower riboflavin levels. Doxorubicin. Riboflavin interferes with doxorubicin, a medication used for the treatment of certain cancers. Also, doxorubicin may deplete levels of riboflavin in the body. Your doctor will let you know whether you need to take a riboflavin supplement or not. Methotrexate. This medication is used to treat cancer and autoimmune diseases, such as rheumatoid arthritis. It can interfere with how the body uses riboflavin, phenytoin dilantin. This medication, used to control seizures, may affect riboflavin levels in the body. Probenecid. This medication used for gout may decrease the absorption of riboflavin from the digestive tract and increase how much is lost in the urine. Thiazide diuretics. Water pills. Diuretics that belong to a class known as thiazides, such as hydrochlorothiazide, may cause you to lose more riboflavin in your urine. Cardiovascular disease. Because riboflavin assists many enzymes with various daily functions throughout the body, a deficiency can lead to health problems. Animal studies show that the brain and heart disorders and some cancers can develop from long-term riboflavin deficiency. Riboflavin regulates circulating levels of homocysteine, an amino acid that enters the diet from animal protein foods like meat. High levels in the blood are a risk factor for cardiovascular disease. CBD riboflavin works with other B vitamins like B6, folate, and B12 to break down homocysteine in the body. Animal studies show heart abnormalities and increased biomarkers for heart disease in riboflavin deficient rodents, as well as cardioprotective effects of riboflavin by increasing the production of antioxidant enzymes. However, how riboflavin is regulated and transported in the heart in humans is not clearly understood. Epidemiological studies have not shown that lowering homocysteine levels with B vitamin supplementation reduces the risk of heart attacks or deaths from CVD. The American Heart Association does not advocate for the use of B vitamin supplements for reducing CVD risk. Riboflavin is found mostly in meat and fortified foods, but also in some nuts and green vegetables, dairy milk, yogurt, cheese, eggs, lean beef and pork, organ meats, beef liver, chicken breast, salmon, fortified cereal and bread, almonds, spinach. Signs of deficiency and toxicity. Deficiency, or riboflavin deficiency, is very rare in the United States. Disorders of the thyroid can increase the risk of a deficiency. A riboflavin deficiency most often occurs with other nutrient deficiencies, such as in those who are malnourished. Symptoms may include cracked lips, sore throat, swelling of the mouth and throat, swollen tongue, glossitis, hair loss, skin rash, anemia, itchy red eyes, cataracts in severe cases, groups at higher risk of deficiency, vegans, vegetarians due to a lower intake or complete exclusion of dairy and meat products, pregnant women, especially in those who consume little dairy, lactose intolerance or meat, due to increased nutrient needs with a growing fetus. Toxicity. A toxic level of riboflavin has not been observed from food sources and supplements. The gut can only absorb a limited amount of riboflavin at one time, and an excess is quickly excreted in the urine, so therefore, a tolerable upper intake level for riboflavin has not been established. Did you know? Ever wonder why you don't usually see milk stored in glass bottles anymore? The reason is due to riboflavin. If the vitamin is exposed to too much light, it can be deactivated from its usable form. Therefore, milk is now typically sold in cartons or opaque plastic containers to block light. This information is collected from different places and is only an informative video for you and not a treatment method. Every day, there will be a new video. Please subscribe so as not to miss.